All right, today we're going to dive into a real medical puzzle. It's one that often starts with a really sudden, really dramatic change to the body.
So picture this. You look in the mirror one day and whoa, you notice some serious swelling. It's in your legs, it's around your eyes, it feels like it's pretty much everywhere. And we're not talking about a little bit of puffiness. This is a condition called edema. And it is the biggest, most visible clue that something has gone very wrong with your body's internal filtering system. So, what on earth could be causing it?
Well, believe it or not, the answer to that whole puzzle really boils down to this number, greater than 3.5 grams. Now, I know right now that probably doesn't mean a thing to you, but stick with me because by the end of this, you'll see exactly why this specific number is the absolute key to unlocking the whole mystery of what we call nephrotic syndrome.
Okay, so here's our game plan. First, we're going to define what nephrotic syndrome actually is. Then, we'll zoom right in on this idea of the kidney's leaky filter. After that, we'll uncover the root causes, walk through how doctors followed the clinical clues, and finally, we'll look at how all the different complications are managed.
Right, let's get into it. What is nephrotic syndrome? The first thing you need to know is that it's not really a disease in and of itself. It's more like a collection of signs, a clinical state, you could say, that all point to a very specific kind of damage happening in the kidneys.
And here's where our mystery number pops back up. The condition is officially defined by this triad of signs. Number 1, heavy proteinuria. That means you're losing more than 3.5 grams of protein in your urine every single day. Number 2, all that protein loss leads to hypoalbuminemia, which just means you have super low levels of a key protein called albumin in your blood. And number 3, the direct result of all that is edema, that widespread swelling we started with.
So you might be asking, what is actually going wrong here? To figure that out, we need to zoom way in, down to the microscopic level of the kidney's filters. These are the tiny gatekeepers that are supposed to be keeping all those vital proteins safely locked inside our blood. Deep inside the kidney, you have millions of these tiny filtering units called glomeruli. Now, in a healthy kidney, think of these filters as having a really tight weave. They let waste out, but they keep the good stuff, like proteins, in the blood where they belong. But with nephrotic syndrome, that filter basically gets torn. It becomes damaged and porous, kind of like a ripped sieve, and it lets all those essential proteins just leak right out into the urine.
And this single leak kicks off a whole domino effect. First, the damaged filters leak tons of protein. Second, with less protein in the blood vessels can't hold on to water anymore. This is what we call a drop in oncotic pressure. Third, that water has to go somewhere, so it escapes the blood vessels and just seeps into all the surrounding tissues. And the final result? That's the massive, widespread swelling we talked about. It's a perfect chain reaction.
Okay, so now we know how the swelling happens, but why do the filters get damaged in the first place? Well, it turns out nephrotic syndrome isn't actually the root of the problem. It's a signpost, pointing to a different underlying disease.
And what's really fascinating here is that the likely culprit often depends on how old the patient is. In kids, the number one cause is something called minimal change disease. For young adults, it's often a condition called FSGS. Move up to middle-aged adults, and we see something called membranous nephropathy a lot. And in older adults, a condition called amyloidosis is more common. And then, of course, there's diabetic nephropathy, which can be the cause for someone of any age with long-standing diabetes.
So with all these potential causes, how do doctors actually figure it out? Honestly, diagnosing nephrotic syndrome is a lot like detective work, and it all starts with that very first clue, finding protein in the urine.
This chart really puts those numbers into perspective. A healthy person loses way less than 0.15 grams of protein a day. Basically nothing. Once you get over 1 gram, you know there's significant kidney disease. But in the nephrotic range, you're losing over 3.5 grams. The scale of the leak is just enormous. It's a completely different leak.
And this is exactly why the very first step in any investigation is to precisely measure how much protein is being lost. The entire clinical path forward really hinges on one question. Is the protein loss moderate or is it substantial, meaning over 1 gram a day? That single measurement is what guides every single test that comes next, including whether a kidney biopsy might be needed.
So you might be wondering, do they always have to do a biopsy? Well, for most adults, yeah. The definitive answer comes from a renal biopsy, where they actually take a tiny piece of the kidney to look at under a microscope. But it's not always necessary. In kids, for instance, doctors often assume it's minimal change disease and just start treatment. And for a patient with a long history of diabetes, diabetic nephropathy is the obvious culprit, so a biopsy can often be skipped.
All right, once the diagnosis is clear, the whole focus shifts to management. And it's not just about trying to fix the leak. It's about dealing with all the other problems that the leak causes all throughout the body, the fallout, you could say. So yeah, we know about the edema, but what else happens when your blood loses so much of its essential protein? You gotta think, protein does a lot more for us than just manage fluid levels.
This table really lays it all out. To deal with the edema, you're looking at diuretics and a low-sodium diet. Then there's high cholesterol. The liver goes into overdrive trying to make up for the lost protein and ends up pumping out too much fat, so patients often need statins. This next one is critical. The body also loses proteins that prevent blood clots, which means patients are at a high risk for thrombosis and might need blood thinners. And finally, because protective antibodies, our immunoglobulins, are also lost in the urine, there's a much higher risk of infection, so getting vaccinations is absolutely key.
And this really brings us full circle, back to the core idea. All of these huge systemic problems, the swelling, the cholesterol, the clots, they all start in one tiny place. As this quote says, it all begins with damage to the glomerulus, that tiny essential filter in the kidney.
So we'll end with this question to think about. How is it that a problem this small, a microscopic defect inside a tiny filter you can't even see, can set off such a massive cascade of serious body-wide complications? It's really a powerful reminder of just how deeply interconnected every single part of our biology truly is.